My girlfriend woke up and saw my arm was twitching, and I said, I can't feel my arm.
I received a phone call that I thought I would never ever. It's like a parent's nightmare. But I received that call at 1:30 in the morning. I immediately just said, 911, call, hurry.
They immediately took me to intensive care, but then they wanted to get the CT scan done, the MRI done, and it quickly showed that I had a hemorrhagic stroke. They told me it was unknown etiology. So we got a referral while I was in the hospital from a neurologist that knew Dr. Dodds.
When I first met Brett, he could not move his left arm. It was in a sling. It was completely limp. He couldn't move his fingers. He had difficulty walking. He was able to walk with a 4-pronged cane. And when I looked at his MRI of his brain, what I noticed is that he had the hemorrhage there that I expected to see, but he also had a separate area that looked like an ischemic stroke. So that amazed and perplexed me because it greatly limited what this could be. So at that point, we spent a lot of time just talking about his history, his symptoms. Did he have any fevers? And then suddenly he said, yes, I did have a fever for several weeks before the stroke. And then I asked him if he had a rash, and he started telling me about this rash that he had in his thoracic region on his trunk. And that sounded a lot like a shingles rash. And I looked at Brad and his mom and his girlfriend and said, I can't tell you with definitive certainty what this is right in this moment. I need to go home and sleep on it.
Dr. Dodds, I remember sitting down and her asking about the weeks leading up to it. I knew that, if anyone was going to find out, it was going to be her.
I woke up at about 4 o'clock the next morning and just thought, it's just got to be varicella-zoster vasculopathy. So I went to the medical literature at 4 o'clock that morning and found case reports with very similar MRIs to Brett's. I called him the next day, told him what my theory was. We had to get the lumbar puncture set up in his town because at that point it was a very big deal for him to have to travel up to Durham for care. As soon as his spinal fluid came back positive, we began antiviral therapy for him. That was when he really started to do this amazing turnaround from a symptom standpoint. His arm started getting so much better, his walking got better. Symptomatically, he is getting so close to normal at this point. He's just continuing to do very, very well.
It's been 8 months since my stroke happened in the beginning of August. Just a couple days ago, I ran 2.5 miles with my girlfriend.
We thought we were going to have to accept the unknown etiology and just go through life not knowing.
Had Brett not been diagnosed with a varicella-zoster virus infection as the underlying cause of his brain hemorrhage and his stroke, there is a possibility that he could have had another brain hemorrhage. He could have had another ischemic stroke. He could have had both. Stroke can happen to anyone at any age. You're never too young to have a stroke. There really needs to be more awareness about how common this is and what a huge problem it is.